In this video, I'll talk about kids and medicine, especially what not to do this December. First, let me say Merry Christmas and Happy New Year. Parents, before you give your child any medicine, especially this holiday season, please listen to this one. Most December emergencies come from very simple and avoidable mistakes in hospitals. Number one, try never give adult medicine in small doses for children. Remember, children are not small adults. It's very important to know the correct dose for the child. Some people try to cut adult tablet into half and they guess maybe that could be enough. No. Let us really stop. Let's listen to the advice of the health professional. I'll repeat, children are not small adults. Because children really metabolize medicines very differently from adults. They have very tiny or small liver. Their blood-brain barrier is not well developed. So if you try to increase a small dose or you make tiny dosing error, it might cause toxicity. Always try to use pediatric formulations in the right recommended dose by the health professional. And the other important mistake I always see is, mixing of cold and cough syrups. Many syrups usually contain the same ingredient. Might have paracetamol, maybe antihistamines and decongestants. So when maybe your child is having fever and maybe coughing, then you'll find some parents mixing maybe the cough syrup with paracetamol. Remember, mixing two different syrups can accidentally double or triple the dose, can cause an overdose. Kindly stick to just one product at a time, unless the doctor really advises so. So let's really avoid children from having an overdose. The other important thing is also aspirin. Aspirin can trigger a rare but a very life-threatening condition called Reye syndrome in some children. So never give aspirin to children unless it is medically prescribed. That is very important, especially if your child is having fever. Don't try to go to aspirin. Please talk to your doctor. Aspirin is, in some children, as I told you, it can cause a very, very bad problem. So the other important thing is where to store your medicines. Kindly store medicines out of reach of children. With visitors, parties, and travel, medicines can end up on, tablets or bags. And, kids are so exploratory because they explore everything. So keep all medicines locked away maybe in high place, in top of, the shelf. The other important thing is also some sweets. Some parents use honey for cough relief. But babies under 1 year, remember, could develop infant botulism. So please avoid giving honey for infants. It's okay, you can mix honey with your tea, with your dawa, with your coffee. No problem for an adult. But for kids, that is a no, especially for infants. So wishing you a happy holiday season. Let's really watch out our health, our kids, especially on their medicines. Let's not really give them an adult dose, an adult medicine, assuming they are small adults. They are not, they are children. Let's look for the correct pediatric formulation. Let's give the medicines in the right dose. That is advised by the doctor. See you in the next video.